Hello there. It is Friday and it is noon and it is Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. And we are located in downtown Humble and we're on the corner of Main Street and Avenue C. So if you're downtown, you want to come by and see me, that'd be great. I look forward to speaking with you. Now today, we're going to be talking about a functional approach to autism. And I found this article and I was really excited to find this article because I learned a lot of things about autism that I didn't know. And this is written by a medical doctor who says that the paradigm that we use today to deal with autism is outdated and it has a lot of areas that need to be improved on. So I thought that was very interesting that a medical doctor would say this. So I'm just going to read to you a little bit of what he says about autism. He says, over the past 30 years, autism spectrum disorder, ASD, has gone from a rare and obscure medical curiosity to a common developmental disorder affecting millions of American children, okay? This article says it affects 1 in 59 children, or approximately 1% of the population in America. This article that I looked at this morning says that in the United States, we have 1 in 45 children who have autism. So that's, it's getting more and more common. And so I'm glad to see that the medical profession is looking at this. And if this affects you and your family, it does affect mine. And so if this affects you and your family, these are some good information points for you. And so you'll be able to have some direction at least, okay? So this article says that the lifetime cost of an individual that has autism is estimated to be $2 million per person. So this is a disorder that is quite costly and it affects quite a few people, okay? He says it is a behavioral and neurodevelopmental disorder characterized clinically by delays and quantitative differences in communication and social interactions, as well as repetitive behaviors and restricted interest. Currently, it is characterized by a vast majority of healthcare practitioners as a subjective psychiatric diagnosis based on behaviors exhibited in the child rather than an objective medical diagnosis based on measurable core clinical imbalances resulting in their abnormal behaviors. So I want to tell you this in just plain old English. There is no blood test, there is no x-ray or anything like that that can definitively say that your child has autism or is on the spectrum. It is purely subjective. Now, I don't ever like subjective tests because it depends on what kind of mood I'm in, how I'm going to interpret results. And so I'm really a fan of objective criteria. Now, when I was an English teacher back in the day and I taught essays and I loved teaching essays, and I had to develop an objective way to grade these essays. I didn't want to just grade it subjectively. Did I like it? Did I not like it? Right? So I developed an objective criteria, and that's what we're going to talk about, objective criteria for your child with autism. And so this is going to be really interesting, and I hope that you'll be really encouraged when you hear this. I thought there was some kind of objective, definitive medical criterion that diagnosed it, but obviously, according to this doctor, there is not. And that is kind of understandable, or it makes a little bit of sense to me because I have had patients come in who said that their school had decided they were autistic or the doctor had decided that they were autistic. And when they came and they spent time with me, I looked at them and I could not discern that. So I'm glad to know that it is subjective and not objective. So we're going to just move a little bit further into this article. Conventional medical practitioners have very little to offer these children because they have been trained that there is no treatment or cure for autism, and the child's symptoms and behaviors are the result of their autism. In the current diagnostic paradigm, the diagnosis of autism in the child is made subjectively based on symptoms and behaviors that exhibit. This reasoning dictates that the symptoms define the disease, the behavior, therefore autism, and the disease causes the symptoms, autism, therefore behaviors. This is a logical fallacy called circular reasoning. Now, if you went to debate class, you know what circular reasoning is. Okay, and now I've never heard a doctor say that, so this is very, very interesting to me. He said it is no wonder that conventional medicine has very little to offer these children beyond applied behavior analysis, behavioral therapy, and possibly a symptom-suppressing medication. And we all know that we don't like symptom-suppressing medications, okay? It says autism is not an entity that affects your child and then causes the disease. It is just a convenient name to place individuals exhibiting similar behaviors. So just kind of make of that what you will. All right. He talks about the role of genetics. Now he says here, and I'm going to kind of paraphrase it because it can get really, really technical and I don't want it to be technical or over your head. He says that the role of genetics, that people have tested different genes to see if they could find from children who exhibited these behaviors, if they had these any similar mutated genes that would be a cause and effect. You've got these gene mutations, and so therefore you are more prevalent or more prone to have autism. And what he says here is there is no gene that can tell you that you have autism. It says billions of dollars have been spent with no substantial changes in the proportion of patients identified with clear-cut genetic cause. This misdirection of research has resulted in a grave disservice to the children with autism, okay? But we're gonna come down here and we're gonna talk about some different cause and effects that this functional medical doctor says. And there are genes that attribute or contribute to this particular type of dysfunction. So while they haven't, and I think what this is saying is that they have been looking for the gene that causes autism, they haven't found that. But what there is, because we do DNA analysis and that kind of thing, and I've got great people that know a whole lot more than I do, but I was doing some research on this, and there are genes that definitely tell you if you're not able to detoxify and that kind of thing. So we're going to kind of break it down into everyday language. So if this is something that you're seeing in your family, I'm going to give you some hope, okay? Because I was very encouraged when I read this. So there are two main principles in a functional approach, okay? The body and the brain, right? It needs particular nutrients in order to function optimally. So that would be vitamins, minerals, omega-3 fatty acids, healthy, clean food, etc. So you've got to make sure that the good stuff gets in. And then the second key principle is that there is something present in the body and the brain that is interfering with the ability to function optimally. For example, toxins, occult infections, disrupted biome, free radicals, cytokines, histamines, etc. Get the bad stuff out. So occult infections are like stealth viruses. They're hidden infections. They're in the body, but they're not causing any symptoms. Now, you might think it's in the body, but it's not causing any symptoms, so that's not a big thing to worry about. Well, it is a big thing to worry about because we are an energetic being, okay? I have energy in my whole body, right? My respiratory system, my digestive system, my liver, my hormones, my brain, every system, my kidneys, every system in the body, right, has a vibrational frequency. And so if we have a latent virus, we'll say Epstein-Barr virus. And we've talked about this before. It is estimated that in the North American continent, 95% of adults have a latent Epstein-Barr virus, EBV. Now, if you have this in your body and it's not causing you any distress, that's a good thing. But if stress comes along, it will absolutely inflame that virus. That virus will start manifesting, and then you get some problems. Now, just because it's latent doesn't mean that it's ineffective. Your body, your immune system knows that it's there, and your immune system is suppressing it, okay? It's causing conditions in the body to be such that this thing doesn't manifest itself. Now, when there is a stressor, an emotional stressor, a physical stressor, then the body takes its energy and deals with the stress, which allows the virus to manifest. So I know that's kind of maybe a little hard for you to understand, but that's what an occult infection is. It's something that's latent in the body that the body is working on to suppress, but it's still taking energy away from the body to do other things. So get the good stuff in, get the bad stuff out, which of course that's what we talk about all the time when we're doing our EAV analysis here. So this is what he says is the current medical treatment, okay? It says the backbone of the current treatment for autism spectrum disorder is applied behavior analysis, a form of therapy built upon the principles of operant conditioning, and evidence supports that the therapy is effective for children with autism spectrum disorder. Occupational and speech therapy are available, and then there are some medications that are available, okay? He says a large and rapidly growing body of research points toward ASD as an inflammatory disease associated with immune dysfunction activated by environmental triggers. So I just want to say that again, okay? It is a inflammatory disease associated with immune dysfunction activated by environmental triggers. Now, what is an environmental trigger? Well, an environmental trigger is anything that is in your environment that goes into your body. Either you smell it, you taste it, you rub it on. That's what it means. And so an environmental toxin would be when I'm outside in traffic and it's stalled traffic and you're getting all that exhaust through your air conditioning system. That's an environmental trigger. An environmental trigger could be you were in the Navy and you were painting the ships with lead-based paint. And so you are in that atmosphere, you're close to that paint, you're breathing the fumes, that kind of thing. Where we live here in the Gulf Coast area, we've got a lot of petrochemical factories and that kind of thing in our area. And so our atmosphere is full of toxins, especially last few months, last few years, we've had several flares and burn-offs of the chemicals at the ship channel. So all of that is environmental toxins that can trigger this kind of thing, okay? So none of us live in the Garden of Eden, and none of us live on a deserted island somewhere. And so you're going to be affected. We all are affected by environmental toxins, all right? So that's really important. Oxidative stress and chronic inflammation are present in the majority of children on the spectrum. This doctor says addressing these two things, oxidative stress and inflammation, is what you need to be doing, okay? The second thing is gastrointestinal disorders or dysbiosis. Now, this is one of the things that we test for all the time when you come in and we're dealing with your health. So if you've got dysbiosis, and what that means is the critters that are living in your GI tract are not what they should be. They're not in the form and the function, or they're not in the ratio that they need to be. And so when this happens, then you can have children on the spectrum. Now, we know from dealing with the clinic that a lot of times children that come in that are diagnosed with autism have textural issues. They've got taste issues, so they'll only eat certain kind of foods. They'll only want certain things, and it's a real hassle to get them to eat healthily. But the thing is, when they're eating what they want to eat, which is usually junk food, they're not getting the nutrition that they need in order to get the good stuff in and calm down that inflammation. So that's really important that you look at the gut and see what you can do. Now, we've talked about this before, but we've got several gut protocols that children can do, and it takes about 63 days to get this all turned around. So that's something, if you have a child that is on this spectrum, you might want to look at that and see if that might be the cause of what's going on, okay? It says that gastrointestinal dysbiosis increases intestinal permeability. So what does that mean? That means leaky gut syndrome. Now, we know that there is a gut-brain connection, and we know that there is a gut-heart connection. So if the gut is messed up, you're going to have some issues. The next one that he says is mitochondrial dysfunction. Now, what is your mitochondria? That is the powerhouse of your cells, okay? And so when you're dealing with this, you are dealing with the genes. And if you've got this kind of dysfunction in there, it is something that you can address with different nutrients. He says the mitochondrial dysfunction refers to the impaired function of the portion of the cell responsible for providing energy needs of the individual, okay? It has been theorized that the mitochondria became generators of inflammation rather than generators of energy. And so we want to find out, why is that? So when you're thinking of inflammation, think of hot, think of on fire. If you've come in to see me and I'll look at your iris and I'll say sometimes this reflex in your eye is very highlighted. There's a lot of white in there. It's hot, okay? That means it's overactive. Inflammation is overactivity. Now, is inflammation bad? No, not necessarily. Inflammation is a, what is the right word? It is a function of the body to tell the immune system, rally all forces, come to the defense. We've got something in here that doesn't need to be in here. So inflammation is like a war cry, and that's a good thing because it mobilizes your T cells, your natural killer cells, your macrophages, and all that kind of stuff, which is a good thing. When inflammation goes on and on and on and on, and it becomes chronic, then you get into disease states because the body was never meant to be inflamed forever. If the body is inflamed and all of your immune helpers come and they cannot squash the inflammation, then you're just going to be using up all your resources and your immune system is going to get weaker and weaker because you're not getting any further down the track, and that inflammation is eating up all of your energy resources. I hope that makes sense to you. It's very complicated. We always want to calm down chronic inflammation. If you have a chronic disease, diabetes, autoimmune disease, anything like that, you have chronic inflammatory processes. And so what we want to do is get that inflammation to come down. Once that inflammation comes down, then the immune system can go to work and find the invader, whether it is a parasite, an amoeba, a virus, whatever it is, and take care of it. So we want to welcome inflammation on the short term, but we want to deal with it and get rid of it on the long term. So I hope that makes sense to you, okay? There are unmet nutrient needs. He said these rarely cause, but commonly contribute, okay, the result from nutritional deficiencies, gastrointestinal malabsorption, or variations and mutations in the enzymes involved for nutrient utilization. Now, that's a lot of words. That's a lot of big words. What that means is the gut function is compromised because you have poor nutrition. I've had people come in here, they bring their kids here, and their kids eat chicken nuggets and macaroni and cheese, and that's it. No fruit, no healthy grains, no vegetables, mac and cheese, and it's out of the box, of course, and the chicken nuggets. And that really is not going to lead to great nutrient absorption there. And so we can look in the DNA testing, and you know we do DNA testing here. We can look at the gastro tract and find out what genes are not working, give you the right nutrients to bridge that gap, and then this will not be an issue. So that's something, I mean, that's encouraging that if this is part of the issue, we've got answers for that, okay? Impaired detoxification. Okay, there are genes that cause this. The most common one is the MTHFR gene. You have to Google it because I can't say that word. It's just way too big. But it's got several different varieties. Basically what it means is that when your cell does its work cycle, you've got different chemicals in there that donate a carbon atom, and it kind of goes around in a clock formation. This chemical donates to this chemical, donates to this chemical, and on around. But there's a breakdown when it comes to the folate and the B12. So there's a big gene called the MTHFR gene, but it has about 6, maybe 8 subcategories of genes underneath it, that if one of those is broken, then your whole set is going to be broken. So that means you cannot detoxify appropriately. So what does the doctor say about this? He says you've got to get the good stuff in and you've got to get the bad stuff out. If you've got this gene dysfunction, you're not able to do that. And that is something that we can learn about, that is something that we can test for, and that is something that we can actually correct if you take the right nutritional supplements. So that's really, really important. It says food sensitivities and intolerances. This is particularly true of gluten and casein. They produce immune dysfunction and inflammation or opiate-like byproducts in susceptible patients. So if you have leaky gut syndrome, which is connected to dysbiosis in the microbiome of the gut, what happens is you've got these really tight junctions in the bowel, in the small intestine and the large intestine. And when you've got that dysbiosis, you've got the bad actors in there like yeast and fungus and that kind of thing. And instead of being tight, the junctions being tight like my fingers are, they go like this. When they spread or they lose their tightness, then the food particles can get through that lining into the bloodstream. The bloodstream sees it as a foreign particle, rouses the immune system to go after it. And so that is part of the inflammatory process that leads to the diagnosis of autism. So I hope that's very clear. It says the next thing, autoimmunity or immune dysfunction. This is frequently caused by persisting gut issues and a contributing factor to decreased energy production and chronic inflammation. Caution should be exercised when altering immune function. Yes, this is something that we learn in school all the time. People come into the clinic and they'll say, I need to boost my immune system. No, you don't need to boost your immune system. Your immune system is only going to boost when you've got an invader. So you don't want to boost it with an invader. What you want to do is strengthen it. You want to go into that system with different nutritional herbs and different things that will actually cause your immune system to function stronger so that when an invader comes, it has what it needs to take care of it. So just be careful of your words. People think that if I boost my immune system that I'm going to be stronger, but really you're going to be weaker. So that's just kind of a technical point there, okay? Impaired production of hormones and neurotransmitters. Now, there are genes that we can test for that will tell you if you are producing the right neurotransmitters or if you are producing or able to produce the right hormones. So he's saying here that this is a great cause that leads to the diagnosis. It says it is evident that a decrease in the oxytocin, the love hormone, the increased level of cortisol, the stress hormone, as well as erratic levels of adrenaline, dopamine, and serotonin are driving much of the self-stimulatory behavior and sleep disturbances that are commonly present on the disorder. So that's something that you need to think about. We might need to do some DNA testing to find out if that is possibly the cause. So this is his conclusion. He says, One or more of these factors are present in almost all the individuals with autism. It is the intricate interplay of these imbalances which ultimately creates the complex clinical presentation of ASD. Dozens of other less common imbalances have also been identified as contributors to the complex condition of ASD. And this is a quote from this article. Autism is now treatable, but we have to displace the outdated psychiatric baggage it brings with it from the 20th century. The optimal approach to treating ASD in the 21st century continues to be early intervention with psychological and educational services, working from the outside in, as well as an in-depth functional medical investigation into the cause and contributing factors, working from the inside out. Now, he does say, and I think I skipped over this part, which I did not mean to. He says, I'm not referring to the ASD children who are unable, he said, I'm not, where is it? He said, I'm not referring to the ASD children who are high functioning, who can write, who can do all this kind of stuff. He said, I'm not referring to them. I'm referring to the ASD children who are unable to engage in simple conversations with loved ones, cannot communicate their needs. These children may spend the majority of their day engaged in repetitive self-stimulatory activities and are frequently unable to go on a simple shopping trip or even sit in a restaurant without multiple meltdowns. These are the children who have a very low level of function and without intervention will likely depend on others for the rest of their life. So he's not talking about high functioning. He's talking about the ones that really need some care. So I'm really, really excited that we've got a medical doctor that's looking beyond the prescriptions, and he's saying, go in and clean up the gut. Go in and see what kind of gene dysfunctions there are, provide the nutrients that bridge those gaps, and then the body's going to function the way the body needs to function. The MTHFR gene is huge. There are autophagy genes as well. Autophagy genes work when you're fasting to go into the body and clean up all the trash and that kind of thing. So there's some really good information here, really encouraging. So you can't tackle all of this at once, but this is something that you can find a good practitioner in your area, or you could come and see us because we test for all of this. We have done this for a long, long time. This is just a great article because it's a medical doctor who says if you do this, you're going to make some great gains in your children that are on the spectrum. So I hope you're encouraged about this. I'm hoping that someone out there has been just very depressed by thinking that this is something they could never win. I'm giving you hope. There are some things that you can do to turn this around. So I encourage you to look into it. I want you guys to have a great weekend. It's hunting season here in South Texas, and it's getting colder. I turned on the radio yesterday, and Christmas carols are already being played. And it's like, it's a little too early for me to get into the Christmas. I like to have my Thanksgiving time, which is right now. Everybody's getting ready for the big Thanksgiving feast. And so I prefer to wait until after Thanksgiving for the Christmas carols, but be that as it may. I know people are already decorating and all that kind of stuff. If that gives you pleasure, if that makes you happy, go for it. Enjoy yourself this weekend, and I will see you next week. Take care. Bye-bye.